Hi, I'm Dr. Janet Pope reporting here at Room Now at ACR 2025 in Chicago. I wanted to talk about something that might be an ACR best. So it's really asking about hospitalizations in people with Still's disease, and is it still infection? So why did I choose this abstract? This was a nice poster. It was number 0163, and basically what it looked at was a national inpatient database where there were lots and lots of hospitalizations for people with Still's disease. So there were 1,827 unweighted and 9,135 weighted American hospitalizations from this very large database. So first question was, why are these people hospitalized? The main reason for hospitalization was infection, but we have to remember that often when someone's flaring their Stills or being diagnosed with Stills, they have high fevers, they have rash, they have high inflammatory markers, a high ferritin. So Stills can mimic an infection. So I would say, is it misclassification? Because of course at this level they didn't have all the positive blood cultures or what was negative, etc. The next thing that's important was the mortality was low, but it was about 2.5% of these hospitalizations for people with Stills. Who did worse? So you did worse if you had male versus female, a black race, or if you were on Medicaid versus private insurance. And Medicaid would be people often with less socioeconomic status, maybe poorer health-related behaviors. However, what I think is most important is when my patient has known adult-onset Still's disease, if they have a high fever and they're sick enough to come into hospital, I think we always have to rule out infection, but sometimes if we can't grow any positive cultures and we've treated for infection and they still have fevers, look at the characteristic of the fevers because it still could be Stills. Thank you, and please join us for more reporting. It's at Janet Pope. Thank you.